know that your central nervous system, or CNS, consists of the brain and the spinal cord. Today we'll talk about the spinal cord. Okay. First, we'll see the anatomy of the spinal cord. Anatomy includes its location, its shape, size, length, those things. So first we'll see those. Then we'll talk about the structure of the spinal cord and functions of the spinal cord. Then we'll talk about the spinal nerves. From both sides of the spinal cord, 31 pairs of spinal nerves arise. We'll see how the spinal nerves are formed. Okay? Formation of the spinal nerve. Then we'll talk about the tracts inside the spinal cord. You already know tracts are the bundles of fibers, right? So, if you cut the spinal cord and see inside, you'll see the tracts or bundles of fibers. Some tracts are taking the signal upwards, that means towards the what? Brain, right? Some tracts are taking the signal downwards, that means away from the brain, right? So, ascending and descending tracts. Now you tell me, ascending should be sensory or motor? Sensory. Remember, sensory signal goes towards the brain, right? And descending tracts are motor tracts. Make sense? So two types of tracts are present inside the spinal cord. We will see the important tracts. Along the sensory pathway, if I touch the skin, sensory signal from the skin goes to the brain, right? So along this sensory pathway, from the skin all the way to the brain, in different locations, the signal is relayed. We'll see the relay of sensory and motor signal. When the motor signal gets out from the brain to the muscle, also the relay occurs. Okay? So we'll see the sensory and motor relays. Then we'll talk about the spinal cord trauma, injury to the spinal cord, and what can happen due to injury. So those are the things we'll go over. First, the location. Spinal cord starts at the foramen magnum. You know that. This is foramen magnum. So it starts here, the upper end, and goes down all the way to lumbar 1. This is lumbar 5th, 4th, 3rd, 2nd, 1. So first lumbar, so ends here. So from here to here, from foramen magnum to lumbar 1. Sometimes it go down to lumbar 2, extends a little bit further and ends at lumbar 2. Make sense? So most of the cases lumbar 1, but sometimes it can go down to the lumbar 2. So, is there any spinal cord in this part? No, because ends at L1 or L2, right? So, at L3, 4, 5, there is no spinal cord. Okay? Now, the length of the spinal cord is about 18 inches. That means 45 centimeter, and the width is half inch or about 14 millimeter. So this is the brain and the spinal cord. Okay. This is foramen magnum here, and this is L1 or lumbar 2. Number 1 or lumbar 2, the lower end. Okay. As I have mentioned, inside the spinal cord, you have two types of tracts, right? Ascending and descending. That means sensory and motor. That's why spinal cord provides two-way communication. That means upwards as well as downwards. Okay? So from the periphery, receptors to the brain, and from the brain to the effector organs. Protection. Spinal cord is also a very important organ in your body. So it is heavily protected inside the body. You know that the spinal cord is located inside the spine or vertebral column. This is the vertebral column or spine, and the spinal cord is located inside this. Okay? So these vertebrae protect the spinal cord, right? We know that. Around the spinal cord, like your brain, you have three layers of meninges or three meninges. Outermost is the toughest one, which is what? Dura. And middle one, arachnoid, and innermost, pia. Okay? Pia mater is attached to the spinal cord. Okay? So you have three layers of meninges. So dura, then arachnoid, and pia is attached to the spinal cord. Okay, innermost one. So three meninges. Dura mater, arachnoid mater, and innermost is the pia. So like your brain. And in subarachnoid space, that means in between arachnoid and pia, you have the cerebrospinal fluid. Same as the brain. Okay? So you have here cerebrospinal fluid. Another thing which is a protection of the spinal cord but absent around the brain. What is that? That's called epidural fat. That means you have fats around the spinal cord, but no fat is present around the brain. So fat is only around the what? Spinal cord. Okay? So this is an extra protection to the spinal cord. Okay? Here, this is a cross section. If you make a cut like this, cross section, and see the structures around the spinal cord. Let's go from outside to inwards. Outermost is the bone. Which bone? Vertebrae, right? Then you have the fat between the bone and the dura mater. That's why it is called epidural fat. Outer side of the dura mater, epidural fat. Then you have dura mater, arachnoid mater, pia mater. You see here, this is the dura, this is the arachnoid, and this is the pia mater. So pia is attached to the spinal cord, and you have cerebrospinal fluid here under the arachnoid mater. That means in subarachnoid space. So those are the protections of the spinal cord. Now, if you see the spinal cord, in two locations, the spinal cord is slightly wider, expanded. So it is like this. This is the spinal cord. In two locations, the spinal cord is slightly wider. Like this, okay. And this is the lower end, and lower end is cone-shaped, like this. Okay. So here you see slightly expanded or wider, and here slightly expanded or wider. So two expansions in the spinal cord. This is called cervical expansion and this is called lumbar expansion. Okay, so two expansions, one in this area, cervical, and another in the lumbar area. Okay, then you have ligaments. This is the pia mater, you know, that innermost meninges, and this is the arachnoid mater, and this is the thickest one, dura mater. Okay, so what happens, from pia, ligaments arise and go to the dura mater like this, and these ligaments keep the spinal cord in right location. It's like, you know, they are tying the spinal cord to the dura mater. Same thing in this side. Okay, so these are called denticulate ligament. Denticulate ligaments. Okay, from pia to dura. So basically, tying the spinal cord from both sides to keep the spinal cord in right location. So when you move your body, spinal cord will not move too much. Make sense? It's like, you know, tying from both sides. The lower end of the spinal cord is cone shaped, and this part is called conus medullaris. Cone shaped part is conus medullaris. So this is conus medullaris. Okay. Then from the lower end of the spinal cord, many nerve roots, these are called nerve roots, arise like this and form a bunch of nerve roots which looks like horse tail. Have you seen the tail of the horse? So it looks like a tail of the horse. So these nerve roots together is called these nerve roots together form the horse tail like structure, and that is called chordae equinae. Chordae equinae. Okay, chordae equinae. Bundle of nerve roots at the lower end of the spinal cord form horse tail like structure. And then another structure that goes from the lower pointed end of the spinal cord or conus medullaris to the tailbone, which is called the coccyx. You know that? Coccyx. So this is a thin cord like a structure. Thin cord like structure goes from the lower pointed end of the spinal cord to the coccyx, and this is called phylum terminale, from the terminal end. Phylum terminal. Okay, makes sense? So those are the structures you can see from outside. How many expansions? Two. One in cervical area, another in lumbar, right? So cervical expansion, lumbar expansion. Now you tell me, why in these two locations you have expansions. Expansions means more or less neurons there. What do you think?
More.
Area is bigger, right? So more neurons. Why you need more neurons in this part and this part of the spinal cord? Because you see, from your upper limbs, many nerves, right, enter into the spinal cord. So you need more neurons there to receive the signal. From lower limbs, legs, many nerves, right, enter into the spinal cord. Make sense? So also in lumbar area, you need more neurons. That's why in those areas you have expansions. Make sense? So two expansions. And the ligaments that goes from the pia mater to dura mater, those are called what? Denticulate ligaments. Okay? Keep the spinal cord in right location. Lower cone-shaped end of the spinal cord is called what? Conus medullaris. Clear? Conus medullaris. And at the lower end, you will see many nerve roots, right? Bundled together, looks like what? Horse tail. That is called chordae equina. Okay? And from the lower pointed end of the spinal cord, a thin cord-like structure goes to the coccyx. So basically, that cord is tying the lower end of the spinal cord to the bone, coccyx. Make sense? So preventing the movement. Okay, so tying the lower end to the coccyx. That is called phylum terminale. Okay, so those are the structures you will see from outside. Now, as you know that spinal cord ends at which level? Lumbar 1, sometimes lumbar 2, right? So below lumbar 2, definitely there is no spinal cord. Make sense? And we use that area below lumbar 2 to collect the cerebrospinal fluid, because you see the covering meninges continues. And you have cerebrospinal fluid in subarachnoid space, you know that. So that fluid is also present here. So we insert needle in this area to collect the cerebrospinal fluid without any chance to injure the spinal cord. Make sense? Because we know that below L2 there is no spinal cord, right? But cerebrospinal fluid is there. So that's a safe location to collect the cerebrospinal fluid. So that is called lumbar puncture. Yes?
So when somebody's pregnant and they get an epidural, where is that given?
That we inject at the nerve root area to numb the nerves. Okay? So you see here, what we do, we ask, yes?
Did you say that's a lumbar concha?
Which one?
The thing that collects the CS? No?
Lumbar puncture, puncture P.
Oh, okay.
Okay, so we insert what? The needle. What we do is, see here, we ask the patient to lie sideways and move the upper part forward like this. So what happens when you move the upper part of your body forward, is in between the spinous processes, you have openings. You see here, you have pretty big openings, right? And when you turn the body this way, these openings get what? Bigger. So you can easily insert needle, okay? And there is no spinal cord in this part, right? But cerebrospinal fluid is there, so you can easily collect the cerebrospinal fluid without injuring the spinal cord, right? Now, why you need to collect the cerebrospinal fluid? If someone has, meningitis, infection, or encephalitis, infection in the brain tissue or covering meningitis. Have you heard that? So, or encephalitis, if someone has, then microorganisms will be found in the cerebrospinal fluid, because microorganisms spread in the fluid easily, right? So if you collect the cerebrospinal fluid and do culture of the fluid, you will be able to identify the microorganism, right? And what kind of microorganism, right? Then you can find the treatment for that to kill the microorganisms. Which kind of microorganism is there and what kind of antibiotic you should use, right? So that is one. Number two, if anywhere inside your central nervous system bleeding occurs, blood will enter into the fluid, right? And you will be able to find the blood cells in the fluid, right? So internal hemorrhage or bleeding can also be diagnosed, right? We can't see, but we can find the blood cell in the cerebrospinal fluid. So very important, right? If someone gets stroke, bleeding occurs, you can find the blood, a trace of blood there. So that's the procedure. Now we'll see the spinal nerves. As I mentioned, how many spinal nerves? 31 pairs. That means 62. From both sides of the spinal cord, spinal nerves arise. Spinal nerves, I mentioned before, are mixed type nerves. Mixed type. Why is a mixed type? Because it has both sensory and motor fibers inside it. Inside it, you have both sensory and motor fibers. Sensory fibers take the signal towards the brain. We know that, right? This way. And motor takes away. Make sense? So, inside the spinal nerves, you have sensory and motor fibers. So, it's not purely sensory, not purely motor. Make sense? Both ways. Now, how a spinal nerve is formed? If I make a cross section here, see, if I just cut here and take a slice out from here, okay, slice with spinal nerve, how it looks like. So this is the cross section of the spinal cord. In the spinal cord, inner part is gray matter and outer part is white matter. So inner part is what? Gray matter and outer part is white matter. So this butterfly shape, inner part is the gray matter. And outer part is white matter. Okay. Now, in each half of the gray matter, you have three horns, horn-like structures. This is front, so this is back. This is called ventral horn. This is lateral, so this is called lateral horn, and this is back posterior, so this is the posterior, let's say dorsal. Posterior is also correct, but we say dorsal horn. So three horns in each half of the gray matter. Ventral horn, lateral horn, dorsal horn. Same thing here. Ventral, lateral, dorsal. Now, in three horns, you have three types of neurons. In ventral horn, these neurons are motor neurons. So these are motor neurons. Okay. In the lateral horn, you have autonomic. So lateral horn has autonomic neurons. Okay? And in the dorsal horn, you have sensory neurons. So dorsal horn has sensory neurons. So ventral horn has motor neurons. These are motor. So ventral horn has motor neurons. Lateral horn has autonomic neurons, and dorsal horn has sensory. Make sense? 3 types of neurons. Same thing in this side. Okay, I am showing one side. Now, these are the axons. Signal travels through these fibers or axons. Now, you tell me, these are sensory neurons, right? And this is the spinal cord. So, these axons or fibers should carry the signal which way? This way or opposite? Towards the spinal cord, right? Because sensory, see? If I touch, it will go towards the spinal cord. Make sense? So, sensory. These are sensory neurons. So, these are the sensory fibers. And sensory fibers will take the signal towards the spinal cord. So, this way. Signal goes that way. Okay? These are what kind of neurons? Motor neurons, right? So signal will get out to the muscle, motor. Make sense? So opposite. Always remember, sensory and motor are in opposite direction. So this is outwards. Motor signal gets out, sensory signal gets in. You already know that. Sensory signal gets in, right? And motor gets out. So now, this bundle of motor fibers is called, this bundle of motor fibers is called ventral. All these are ventral, root. So root is the bundle of fibers. And this bundle of sensory fibers is called dorsal root. Easy. Dorsal root. Okay. In the dorsal root, there is a round structure called a ganglion here, where you have another group of motor neurons. So everything in this side is motor, dorsal, sensory, and in ventral side everything is motor. So another set of sensory neurons here. So this is one set, this is another set of sensory neurons. And this round structure filled with sensory neurons in the dorsal root is called dorsal root ganglion. Dorsal root ganglion. A round structure in the dorsal root which is filled with sensory neurons. In ventral root, you don't have that structure. Okay. So these are the fibers bringing the signal here, and then from these neurons the fibers are going to these neurons. Okay, so these are sensory fibers, and these are motor fibers. Now you see what happens. This is interesting. The sensory and motor, that means the ventral and dorsal roots, they join together, and that is the spinal nerve, formation of the spinal nerve. So this is the spinal nerve. So spinal nerve is formed by the union of what? Which two roots? Ventral and dorsal. Ventral root brings what kind of fibers? Motor, right? And dorsal root has sensory. So you see two types of fibers are joining. Make sense? To form the spinal nerve. So spinal nerve has what? Both sensory and motor fibers. That's why it is called what? Mixed type nerve. Is it clear? Okay. Then what happens after the spinal nerve is formed? Spinal nerve is very short. Just comes out this way. You see here, intervertebral foramen. So spinal nerves get out here and then divides into two. So it is very short and divides into two, like this. Two branches. Okay. Now what is important here, that now in both branches you have both types of fibers. That's why spinal nerve is formed here, to combine two types of fibers, then give two branches, and both have sensory and motor fibers. Is it clear? And these are called rami. This is ventral ramus, ventral ramus is singular, rami is plural, and this is dorsal ramus. So ventral ramus, dorsal ramus. Everything in this side is ventral, right? And everything dorsal. Is it clear? Let's quickly review. So spinal cord, outer part is what? White or gray?
White.
White matter. Inner part is gray. Looks like butterfly, right? Inner part. Okay. In each half of gray matter, you have how many horns? How many horns? Horn. 1, 2, 3. This is ventral horn. This is front, right? Ventral horn. This is what? Lateral horn and
Dorsal.
dorsal horn. Is it clear? And in 3 horns, you have 3 types of neurons. Ventral horn, you have what type of neurons? Motor. In lateral horn, autonomic, right? And in dorsal horn, sensory. Is it clear? Okay. So, 3 horns. Now, the bundle of fibers are called what? Roots. So, this is ventral root, right? And this is what? Dorsal root. Everything in this side is ventral, right? Front. Dorsal. Ventral root contains what type of fibers? Sensory or motor? Motor. Everything is motor in ventral. And dorsal root contains sensory. Okay? And a ganglion, a round structure, is present in which root? Dorsal root, right? That means in sensory pathway, and which is filled with sensory neurons. Sensory pathway, sensory neurons. Make sense? Okay. That is called dorsal root ganglion. Ganglion in dorsal root. That's why it is called dorsal root ganglion. Then 2 roots combine together to form what? The spinal nerve. Okay? That's the formation of the spinal nerve. Now spinal nerve has both types of fibers, right? Then spinal nerve divides into two what? Ramus. Ventral ramus and dorsal ramus. What is the difference between the root and ramus? Root has one type of fibers, right? Ramus has both. Clear? Okay. Then you have the body here. So you see here, spinal nerve comes out like this and divides into ventral and dorsal. Make sense? Ventral and dorsal ramus. So this is dorsal ramus, this is ventral ramus. Make sense? So ventral ramus supplies the front part of the body, innervates the front part of the body. Dorsal ramus innervates what? The back part of the body. Is it clear? So that's why you need two branches. Okay? So your back part is innervated by the dorsal ramus and front part is innervated by the ventral ramus. But both back and front are getting both sensory and motor signals. Make sense? That's why spinal nerve formation is very important. Just think that if spinal nerve is not formed, your body is here, then what will happen? The back part of your body will get only what kind of supply? Sensory, right? Sensory. And front part will only get motor. Make sense? Then if that happens in front part, you have the motor, that means you can move, you have motor control. In back part, you have sensory only, no motor. Make sense? That means you cannot move, you can only feel sensations. In front part, you have motor only, no sensation in the front part of the body. Make sense? That we don't want. We want both sensory and motor everywhere in the body. Is it clear? That's why spinal nerve formation and formation of ramus is important. Okay? So if I ask you, draw the spinal cord and show the formation of the spinal nerve, you will draw this whole thing, okay? And show those structures, okay? Very important for your exam. Okay, so now the white matter part, that means the outer part of the spinal cord, you have the tracts. You remember I said two types of tracts, ascending and descending. You remember that? So in the spinal cord you have both ascending and descending tracts. But remember the tracts are located in the white matter. Located where? White matter. That means in the outer part. Some tracts are going like this, taking the signal to the brain. Those are ascending, right? And some tracts are going like this, downwards, taking the signal downwards. So descending. So sensory and motor. Both types of tracts are present. Here, you see, this is the gray matter part, inner, like butterfly. This is the outer white matter, and the tracts are shown by blue and red colors. Bundle of fibers, tracts. Why two colors? Because some are ascending, some are descending, right? Ascending or sensory are shown by blue, and descending or motor are shown by red. So now we'll see just few important tracts. First, let's see the sensory. Important sensory tracts include spinothalamic, spinothalamic tract. We have two pairs of spinothalamic. You see here, ventral spinothalamic and lateral spinothalamic. This is ventral, that is lateral. Same thing here, ventral and lateral spinothalamic. So we have two pairs of spinothalamic. Is it clear? And spinothalamic tracts carry pain, temperature. Pain, these are sensory, so pain and temperature are carried by the spinothalamic tract. Then you have two pairs of spinocerebellar tracts. Spinocerebellar. Do you remember cerebellum? Helps in what? Balance equilibrium, right? So, what kind of signal should go to the cerebellum? Cerebellum needs the signal that helps the cerebellum to maintain what? Balance. Make sense? So, from our muscles and joints, the body position, like when I tilt my body, cerebellum should know, right? I am falling this way. So, it will try to fix it, right? Balance. So, the body position signal from the muscles and joints go to the cerebellum through the spinocerebellar tract. So those are ascending or sensory, and in the back part of the white matter of the spinal cord, you have two more tracts, fasciculus gracilis and fasciculus cuneatus in the back part. Fasciculus gracilis and fasciculus cuneatus. Just remember that those tracts carry touch and pressure. If I touch your skin, right, you can feel that, right? If I press, you can feel that, right? Pressure. So touch and pressure signals are carried by fasciculus gracilis and cuneatus. So those are important sensory or ascending tracts shown by blue. Now, descending or motor tracts. Most powerful and important motor tract is called the cortico-spinal tract. It has another name that is called pyramidal tract. Okay, cortico-spinal tract. It carries motor, this is motor, descending signal from the primary motor cortex, precentral gyrus, primary motor cortex to the muscles, skeletal muscles. Okay, so the pyramidal tract is very powerful. It carries the signal from the primary motor cortex to the skeletal muscles, and we know that skeletal muscles help to move the body, right? So the main motor tract helps in the movement of the body parts. Other motor tracts are vestibulospinal, tectospinal, rubrospinal. Those are rubrospinal. So these are other motor tracts. Now, one way to know which one is motor, which one is sensory, almost all motor tracts or descending tracts end with spinal. End with what? Spinal. Corticospinal, rubrospinal, tectospinal, vestibulospinal. Make sense? So if I ask you, is this a motor or sensory? You can tell, right? if you see end part is spinal, that is what? Motor or sensory? Ends with spinal. Motor, descending, right? Motor. We are talking about motor. Okay, corticospinal, tectospinal, rotospinal, right? Vestibulospinal, going from different parts of the brain to the spinal nerve. That's why ends with spinal. This way, look, going to the spinal nerve, right? From the brain structures. Now, many of sensory tracts start with spinal, like spinothalamic, spinocerebellar. Make sense? Sensory start with what? Spinal. But fasciculus gracilis, fasciculus cuneatus are different, right? You have to remember those don't start with spinal, but they are also sensory. Is it clear? Okay. Now, as I mentioned, that along the sensory and motor pathway, relay takes place. Have you seen relay race? One person carries the flag or a stick, right? And